No, I have not gotten anything that would suggest that. Yes.
Yes, I have a question for Dr. Robinson. Dr. Robinson, there are some in the community who believe that the way you get a heart attack is through two modes. Number one, you're too old, and number two, you work too hard. And with those type of perceptions, what is the best way for a district resident not to get a heart attack during the COVID-19 period?
Well, that's certainly a myth, because I have patients that are unemployed that have heart attacks and that aren't as stressed out, and people that are in their 30s. So certainly you want to look at the major risk factors that are common in most of our cities, especially in major urban areas: diabetes, hypertension, high cholesterol. Those are sort of like the tip of the iceberg when you think about the risk factors that contribute to a heart attack, but there's a bigger issue we call health equity and the social determinants of health. So transportation, housing, security, policing, all those factors play a role in precipitating cardiovascular disease and other chronic conditions. So we can't look at just one particular factor and say you should go out and walk more or you should live in a better neighborhood, because we know that can't happen. There are people that are in environments that they don't feel safe going out for a walk, or there may be a liquor store or carryouts on every other block, right? So they may have to take a couple of buses to get to a good grocery store. So it's not that simple when you talk about putting a cookie cutter mechanism to help decrease those risks of strokes, heart attacks. You can play a role in being more active, certainly. You can play a role with watching the kind of diet that you have. And it's not always more expensive to eat healthier when it comes to that factor. So it's a community, it's a group effort that will have to help. As I said, policing, housing, transportation, food securities or food insecurities that'll have to play a role in helping to reduce that.
And let me just say this is that in like a year's time, I lost 3 people in my circle to heart disease or heart attack who were all less than 50, and in a couple cases in their early 40s. And one was a woman. And so I just want to, at that point in time, for everybody that I knew, I always asked them the question, have you had a checkup? How's your blood pressure? Are you taking your medicine? Also, all of those things I think are huge myths. Young people drop dead of heart attacks, sudden death all the time. And we have to definitely dispel the myths of only being elderly and only being a man or only being this or that, to pay attention to your heart health and managing chronic illness.
If you go into any dialysis center in the city, you'll see younger African American men and women in some of those dialysis centers, and some of the complications are from diabetes and hypertension.
Okay, thank you very much, everybody.
Well, Governor Gretchen Whitmer says she'll roll back reopenings if coronavirus cases continue to rise. And one thing she doesn't want to see is hospitals and healthcare workers getting overloaded once again. So this morning, the doctor's in, and joining us this morning, Dr. Rena Deza, family medicine with Henry Ford Health System. Dr. Deza, thank you for being with us. It's been quite a journey. You were really working on the front lines back in April. Tell us what it's like now at the hospital system.
Well, good morning, Dina. Thanks again for having me. I'm back in my clinic right now. I know I was deployed to the hospital for a good 6 weeks or so doing inpatient work, doing ER work. But now back in the clinic, we're seeing patients coming back in for their chronic conditions, seeing sick visits. We're still doing a lot of virtual visits, which is very helpful for patients who are acutely ill.
I want to talk about the numbers, because that is what we get every day. We get a new total of people who are infected. We get a death toll every day, and the numbers are going down for the most part, at least here in Michigan. Do we take comfort from that? Do we say, okay, we beat this, we can go and live our lives now? Explain those numbers to us.
This is definitely not the time to let our guard down. We have worked so hard to remain socially distant. We closed down our economy. This was all to control that massive surge that we had here in Michigan. And so definitely not the time to let our guard down. We still want to wear masks in public. We still want to remain socially distant. I know things are opening up and it's summertime and we want to get out there. Be smart about it. Make sure that you're remaining 6 feet apart. If you're ill, stay home.
Let's talk about wearing masks. And we know that being outside, doctor, there is some UV protection that comes from the sun when it comes to that virus, and there's some ventilation. Describe the importance of wearing masks and where you should wear them.
No, Dina, it's really the simplest thing we can do to help prevent the spread of this virus. One projection said that 33,000 deaths could be prevented by October if 95% of people wear masks in public. So those numbers are pretty remarkable. A very simple thing that we can all do to help prevent that transmission and spread of the virus.
This is allergy season, and a lot of people have a cough and perhaps maybe sometimes a fever when it comes to allergies. That can be similar to COVID-19 symptoms. How do people discern what they're going through?
Yeah, definitely. We are seeing a lot of allergy flares in our clinic, and some of the symptoms do overlap. So, reminder, the symptoms of COVID, cough, shortness of breath, fever, but you can also get a cough with allergies. You can also have a runny nose, a sore throat. So how do you know what's what? Well, the simplest thing you can do is take your allergy medicine and see if it gets better. And if it does, then maybe it was just allergies. But you can always reach out to your healthcare provider, and we are more than happy to talk through your symptoms and decide whether or not you should be tested for COVID-19.
I want to ask you about the flu shot, and we know that science is working very quickly to try and come up with a COVID-19 shot. Every year with the flu shot, doctor, as you know, about half of Americans don't want to get it. What's the message this year?
Definitely, please get it. We get our first batch of flu shots probably at the end of August, and flu season is coming. And so the more people who are protected against the flu, the more we can prevent a surge in the hospital. Now, the flu and COVID, 2 different viruses, but co-infection with 2 different infections, not uncommon. So if you get that flu shot, you're protecting yourself against the flu and protecting your overall health.
All right, I want to bring in the gang here, bring in my squad. Jay Towers, Amy Andrews, going to jump in for a couple of questions as well, doctor.
Sure.
Waiting for, there we are. Hey, Doc, how are you? Thank you for being on with us today.
Good.
So here's
Good, how are you?
Here's my question. So yeah. I guess my question is, what is your level of protection and how long? And when I ask that, if we go visit my parents and we wash our hands, we've hand sanitized, wearing our masks, we sit down, we're sitting very far away, we have a burger from the grill. We need to pass ketchup. At what point are you wiping your hands and not touching everything every second of that entire experience?
Yeah, that's a great question. The main thing to remember is that this is a respiratory virus. And so the mode of transmission is really from person to person. Now, can it be on a surface? Yes. So if someone is ill, for example, and they cough on a surface and then you happen to touch the surface and then touch your face right after, then that could be a mode of transmission. So just being mindful of that, making sure that you're washing your hands regularly. You can share the ketchup, but don't touch your face afterwards. Making sure that you're washing your hands for 20 seconds, hand sanitizer, wiping down counters frequently is going to help a lot.
And Amy Andrews here. Good to see you, doctor. Speaking of wiping down counters, we have heard, a lot of different things about how long it lives on the surface. And now they're starting to market wipes. If you're lucky enough to be able to find these Clorox wipes, the ones that I have say healthcare 1-minute contact time. Is there something you need to see in these wipes that you're using to make sure it indeed kills the coronavirus and just make sure you're doing it right?
Yeah, so most disinfectants, like the Clorox wipes, should kill the virus. You just want to look for at least 60% alcohol base. So either alcohol wipes or the Clorox wipes, most of them should kill the virus.
All right.
Dr. Deza, let me ask you, because it is a really hot day, people might be needing to stay inside to stay safe, perhaps going to a cooling center, finding air conditioning. How do we, what's the balance? And we're trying to figure out how not to get the virus, but also how to live life and protect ourselves from other issues.
Yeah, my advice would be just to be smart about it. You know, if you are someone who is immunocompromised, if you're an older person, avoid larger crowds, avoid going to places indoors where a lot of people are congregating, even if you are wearing a mask. So again, you know, remaining socially distant as much as possible, wearing the mask, lots of hand washing, good old fashioned soap and water, but also, you know, with alcohol wipes, at least 60% alcohol. If you continue to take these basic precautions that we now know has worked and helped us in Michigan, then hopefully we can prevent a second surge, and that's the goal here.
And Doctor, just real quick before we let you go, right now in the hospital, we're hearing from different hospital systems that there are very few COVID patients. Does that give us some hope, or is this a false sense of security?
Well, what that tells us is that what we had been doing this entire time has worked. So we know that remaining socially distant works. We know that washing your hands and wiping down counters works, that masks work. So what that tells us is that we need to keep going and continue that, because now things are open. You know, as a reminder, I mean, we all know the economy was shut down for so many weeks. And so although that helped us get to this point, we don't want to have another surge. So keeping up with these things, not letting our guard down, it's going to go a long way.
All right, Dr. Rina Deza, we're going to continue our conversation coming up in the 9, and we invite our viewers to jump in the conversation and ask questions. Go on Twitter and use hashtag the 9. The doctor is in this morning. We'll take a quick break. Thank you, doctor.
Thank you.
Welcome back, everybody. We are seeing an uptick in COVID-19 cases across the U.S. Here in Michigan, though, they're relatively low, climbing a little bit. Our governor warning if they continue to rise, we may see reclosures. This morning, the doctor's in. Joining us this morning, Dr. Rina Deza, family medicine with Henry Ford Health System. Dr. Deza, welcome.
Thank you, Dina. Thanks so much for having me again. Good to see you guys.
Yep, the gang's all here. We're going to jump in with our questions. In the next segment, we're going to answer viewer questions. So again, it's hashtag the 9 if you guys want to get in on the conversation. Doctor, let's talk about how it's spread. We have seen video of people gathering. We saw a really robust 4th of July gathering at a lake on the western side of the state. Lots of people coming together, partying. Outside, is it safer? Is it less likely to spread outside?
It's definitely easier to social distance outside. Now, can you still spread it from person to person while outdoors? Yes, absolutely. So we still say avoid handshaking, avoid the hugs and kisses. I know you guys are showing that, you know, people congregating together, getting super close together. Still not a safe idea. Again, remaining 6 feet apart, wearing masks, that's going to be very key. And I want to emphasize wearing a mask over your mouth and your nose. I've been seeing a lot of people who have it, you know, below their nose, and it sort of defeats the purpose. So wearing that mask appropriately, super important.
I know we talk about it being spread through respiratory droplets, and that's the point of wearing the mask, is that if let's say I have it, and I don't know I have it, I'm asymptomatic, I'm walking around the store, I have my mask on, I'm not giving it to anybody. Explain those respiratory droplets. They're out in the air, and I know there's debate on whether they are airborne or not, so we won't get into all that, but and then they land somewhere on me and I get them into my system somehow, right?
Well, without a mask, yes, that's the concern. The concern is that if someone isn't wearing a mask and they have the virus and they're near you and they happen to sneeze and, you know, those respiratory droplets come near you and get into your system, then that's the way that it spreads. And so wearing that mask can prevent those respiratory droplets from traveling so far. Just as an example, we know a cough can go up to 6 feet. We know that a sneeze can go much farther than that. And so the mask helps keep that in, and that you won't be able to spread it as easily.
All right, Elle?
Yeah, doctor, I wanted to ask you about the growing number of patients, perhaps they were asymptomatic, who are several months after their first positive test are either still getting positive tests, even though it's been much longer than that 14-day period, or they are experiencing still symptoms that seem like they could maybe create longer-term issues, lung issues, just to name a few. Can you talk about, have you seen any of that, or can you name some of the issues that you have seen with people coming in?
Yeah, so one of the things that we are learning about every day is the immunity that we gain after having this virus. And we still don't know, if someone has the virus and they overcome the virus, how long does that person have immunity? Can they get it again? When is that? And so my advice for someone, even if you had it and you overcame it, or you were able to overcome it, then please make sure that you're still taking precautions, because we don't know if you can get it again. We don't know, even if you had a positive antibody test, how long you may or may not have immunity for. So, continuing to take precautions like everyone else is going to still be the key going forward.
All right, Derek, over to you.
All right, Doc, I got a question about the very last thing you just said, those antibody tests. How accurate are they? Have we seen improvements with the accuracy? But more importantly, I feel like people that have gotten a positive antibody test are walking around thinking they're invincible. Can they be carriers even if they have the antibodies?
Yeah, that's a good question. So, the antibody tests, they're not 100%. We're working to improve them every single day. So, it's good to get an antibody test. And if you're positive, then it shows, yes, that you did come in contact with the virus and you overcame the virus. But I want to emphasize, it doesn't tell us how long you may or may not have immunity for. So just because you have a positive antibody test, and again, it's not 100%, so there is some overlap. But even if you did have antibodies towards the COVID-19, we just don't know how long that immunity lasts. So making sure that even if you had it, you overcame it, still take those precautions going forward. That's going to be super important.
All right, and if I could ask one more question here. We are a household, we have 2 young kids, and we're struggling with the decision of sending them back to daycare. When's the right time to put them in a situation where there's going to be, a lot of kids and a lot of people in one room? Have we seen any evolution with the virus when it comes to children?
That I won't be able to speak on. I believe that kids are still getting infected or they may be carriers, but as we know, most of them are tolerating it very well and they exhibit very little symptoms. So we don't know that that's still ongoing, but I know that we're still studying the virus in children. So far so good with kids.
Doctor, I want to ask you about herd immunity, because that's one of the phrases that we hear a lot about. We say, yes, more people are testing positive, but that's good for herd immunity. Can you put that in perspective for us?
Well, I think that's going to be really important, especially when we get a vaccine. Again, we're pushing the flu vaccine. The flu is a different virus from COVID-19, but once we do get a COVID vaccine, it's going to be super important. The more people who get the vaccine and the more people who are protected against the virus, then we will reach that level of what we call herd immunity, which means that, we do have antibodies towards that virus. Less people will be able to transmit the virus, and we'll be protected as a whole as a society. So very important once that vaccine comes out.
Okay, in other words, we don't risk infecting large quantities of people to achieve that herd immunity until we've got the vaccine and can achieve it safely. Got it.
Yeah.
All right. Doctor's in this morning. Dr. Rena Day's Henry Ford Health System is here to answer your questions. Doc, we got some good ones from our viewers. My husband has to travel out of state to Indiana. How do we take precautions to make sure he's safe while staying at a hotel? And should we quarantine when he gets back? He always wears a mask.
Well, that's great that he always wears a mask. Kudos to that. I will say, so in Michigan, we don't have a requirement at this time for anybody coming in from out of state to have to quarantine for 14 days. And unfortunately, when you're going out of town and you're going to hotels, you're just at that much of a greater risk of contracting the virus because you're around more people. You don't really know how well the hotels are clean. So if you want to be very aggressive about it, you can take your own sheets or you can wipe things down yourself. You don't necessarily have to quarantine when you come back, as long as you're wearing that mask the entire time that you're there, you're remaining socially distant from others while you're there, and just taking those standard precautions should be okay.
Okay, here's another question for you, Doctor. With the new surge of COVID-19 cases, is there a way of identifying how these people are getting infected? That's a good question. Is it from not wearing a mask, going to large gatherings? Are they following guidelines and still getting sick?
Yeah. So we know that now that things are opening, we expect an increased number of cases. We expect it. The economy is not shut down. People are going to be congregating. People have to go back to work, and you just have to be around one another. Again, the main mode of transmission is respiratory droplets from person to person. So even if you have to go back to work and you have to attend a meeting, if you're indoors, wear a mask, try to stay away from one another. But yes, definitely. I mean, we expect to see an increased number of cases just because things are reopening at this time. We just have to make sure we don't let our guard down.
Doctor, is it safe to be at a funeral inside a church or a mosque if the deceased dies of COVID-19, or even, I would say, just being around other mourners for any death?
That's a great question. I actually get that question a lot in my clinic. Again, respiratory droplets is the main mode of transmission from person to person. So really important to know that if a person is deceased, they are no longer a vector for the disease. But you mentioned it, Dina. The thing that really worries me is that social gathering. Now, of course, if it's a funeral, if it's a church service, if you're going to the mosque, make sure that you sit 6 feet apart. Make sure that you're wearing a mask over your nose and over your mouth while you're indoors. And even outdoors for that matter, outdoor settings where you cannot adequately socially distance. But again, you are not a vector for the disease if you are deceased. I'm more worried about the social gathering.
What about people with asthma? Will someone with asthma avoid doing things around others? Are they at higher risk if you have asthma?
So they're at higher risk for complications. And actually that goes along with anyone who has a respiratory illness, any people who have, for example, COPD, if you're a smoker, an asthmatic, as you mentioned, if you're immunocompromised, you unfortunately, if you contract the virus, you are at a greater risk for developing complications. So you want to take the extra precautions to avoid contracting that virus. Wear your mask, social distance, continue washing your hands regularly.
One more question here, Doctor, and Rob and also viewer Joan kind of have similar questions. It's about interacting with other people. So Rob says, my parents live in Florida. They're coming back here to Michigan for a week or so. I'd like to see them before they go back to Florida. Is it safe? And Joan kind of has a similar question about people traveling. How can you see them or be around them safely?
Yeah, so unfortunately, we're seeing a huge surge in cases in certain states, particularly some southern states like Florida, like Texas. So, Florida in particular, it's tough because they do have a lot of cases, especially in that southern area. I mentioned earlier that in Michigan, we don't have a requirement for anyone coming in to have to quarantine for 14 days. So my advice would be, yes, if you want to see your family members, try to do it outdoors. Make sure it's super hard to avoid the hugs and kisses with your family members, especially if you haven't seen them in a while, but you're going to have to try to avoid that direct contact with your loved ones, but you can see them outdoors in the appropriate setting, wearing your mask the entire time. Just take special precautions and it should be okay.
All right. Well, that's good. That is good to hear. Dr. Deza, thank you so much for your time this morning. We appreciate you.
Nation's first
Thanks for having me,
stay-at-home
Dina.
order
Good to see you.
on March 19th. Its purpose was foundational, was to save lives and to better prepare our healthcare delivery system for an inevitable increase in capacity needs. And that increase was not only increase in terms of place, meaning identifying the opportunity to provide conditions where we can find physical assets for individuals' space, but also the appropriate number of people to help support individuals in needs and, of course, the appropriate level of personal protective equipment that is foundational and essential to safely providing that care. So as we move forward on March 19th of this year, we, with intention, began a process anew to identify those foundational components so that we can meet the needs of those that need to access hospital care and receive high-quality care in the state of California, and to look to utilize our existing hospital footprint, the capacity that exists within a hospital setting and within the larger hospital campus setting, to build capacity. In addition to that, of course, we look to identify alternative care sites all throughout the state of California. You may recall a few months back we talked about FMS. These were the federal medical stations that we were able to get from the federal government. We identified locations throughout the state of California to pre-position those FMS sites that provide capacity up to 250 beds to meet the medical needs of the system, to help decompress the hospital system, to provide alternative care sites to meet the needs of patients that either were pre-symptomatic, asymptomatic, or in some instances were not in need of acute care, but need of intense medical care that may have been exposed to COVID-19. We identified additional sites throughout the state, including old mothball hospitals, Seton being an example in Northern California. We had identified early on St. Vincent down in LA County. We procured sites that are still under contract. And
all right, folks, don't you worry here. We're getting you really focused and ready for News Now in just a little bit.
We, with intention, began a process
So, think it make an appearance. More projection, more technology, more bullshit. I mean, look at his mouth. You would love to post a letter through that, wouldn't you? Fake. Like I said, fake. Fake. More fake. More fake. Fake. Let me zoom in. I'm going to keep doing this until somebody gets the message and starts helping me. 'Cause I need help. I've got a lot of information I need to share. But it's so much. It's so vast. I can't do it because I'm wasting my time doing shit like this when somebody could be helping me do it. Right? Simple as that. Just get back into this image again. Across this way. Sorry, bear with me. Here we go. Same thing I showed you on Donald Trump's head. Except this is a bit better. Let me just get into this one. We might have more opportunity here than what I've... Oh, right, okay. I'm not going to get anywhere there. This is basically near enough as good as I'm ever going to get it. Do you know that? In fact, I might actually do something with that. Let me just jump back into that one again. If I turn that up, yes, that is it. Hey, maybe I got something. Right, let's have a look now. So this is what this happening with this guy's hairstyle. Who else would like a hairstyle like this? Who else would like a hairstyle like this, guys? Anybody? Anybody out there? Let's go back up there. Let's go round outside. Right. Go in here again. Go in his nose. And then his mouth. Just have a look at that and tell me that's real. There's another hole there. And here we go. Rotary again. Go. No, I don't want to do that. Shit. Yes.
Anew to identify those
Movement.
foundational components so that we can meet the needs of those that need to access hospital
controllers.
care and receive high quality care
You
in
see,
the state of
it's
California,
fake.
and to look to
All
utilize
fake,
our
folks. Look at
existing
this.
hospital footprint,
Live
the
action.
capacity that exists within a hospital setting and within the larger hospital campus setting.
There you go.
Build capacity.
Fake bullshit.
In addition to that, of course, we look to identify alternative care sites all throughout the state of California. You may recall
Fake as shit.
a few months back, we
Let's go up here and see all the action going on.
federal medical
Check this out.
stations that
There we go.
we were
Just stay
able,
there.
to get
It's all happening in there, isn't it?
identified locations throughout the state of California to pre-position those FMS sites that provide.
I would just like people just to
50 beds
try and help me here.
needs of,
I could be doing my help. I don't know how many times I need to ask.
to provide alternative care sites.
I do know a lot, and I can reveal a lot more if I have help. I'm looking for a co-host. I'm looking for somebody to help me. There we go. Where have you seen this before? You remember, but I don't know if you watched the video. If you're watching this and listening, you might have watched the video. Castle Romeo. A few other videos where I've found this technology. Well, here it's again. This is today. Let's go in here.
Alright folks, don't you worry here. We're getting you really focused and ready for
It's in everything,
just a little bit.
everywhere. So, I'm going to end this. Thank you.
I want to check that out again. There we go. I like that. There we go. I like it. Just testing everybody. We're focused, we're ready.